Here at the clinic, when you come in for treatment, we have a 5-step process to get you out of pain and get you back to full recovery. The first step is to rule out any kind of structural problem. And what we mean by that is we need to make sure that there is no structural issue in the joint in which you feel pain. For example, ruling out if there is any kind of tearing of a muscle or a tendon, ruling out if there's any significant disc bulges, ruling out if there's some kind of small fracture, if there's anything structural for which we need to refer you on for perhaps further imaging. So that's always the first step of our assessment, is to figure out, is this a structural problem or is it something in which we can help? If it's something in which we can help, then we move on to the next step, which in most patients is all about lowering inflammation and lowering the pain associated with that inflammatory process that may have been lingering on a little bit too long. And we do that mostly by using low-level laser therapy, of which you can learn more about in another one of our videos. But using the lasers, we're able to speed up the rate of healing and lower that inflammatory process. Then we can move on to the main bulk of the treatment process here at the clinic, which is the third stage, which is about desensitizing. So using the method here at the clinic, what we try to do is find areas of heightened sensitivity, and that's the best way to describe it. Often this is areas of past trauma where the body is still hyper aware of that region and moving in a way to avoid further or newer injury to that area. And so by desensitizing these old areas of injury, often, we're able to lower the amount of threat that your nervous system senses so that it doesn't need to try to protect you any longer. Because if you've watched some of our videos about why you feel pain, you'll already recognize that pain has nothing to do with damage and everything to do with your brain and your nervous system trying to protect you. So desensitizing your nervous system to past injuries and areas that it might be trying to protect you from is absolutely key. And only once we've done that can we move on to the 4th and 5th stages, which is about improving your range of motion, improving the mechanical, the biomechanical ability of the joint, for which we can use conventional manipulative methods and mobility exercises for you to do at home. And then finally, once that range of motion is restored, then it's all about integrating that back in and getting some strength around the joint, actually loading up the joint. We know that all tendons respond really well to loading and stressing, and so strengthening up the area is always the last part of the process. Many patients that come into the clinic fail and have failed before because they try to do the strengthening too soon. But because the brain is still trying to protect them, there's no way that strengthening is going to help them, because they first need to lower that protective response and then lastly strengthen, which is all about bulletproofing, reinforcing the work that's already been done. So hopefully that outlines the basic structure of the treatment process that you're going to go through. And if you have any questions, feel free to ask.